on this symposium on positive psychotherapy. And dear colleagues and friends, it's indeed a great pleasure and honor to be here at such a wonderful international gathering where really people are dedicated to make this world a better place. And I think it's not just words, I think everybody really is very motivated about that. Well, this is the usual thing, no financial support for this Congress, and of course, being active in the movement of positive psychotherapy, I'm very excited about that, you will feel that. Well, it takes me a long way from Vista in Germany, this is near Frankfurt, to get here, and if I'm not traveling around, usually I'm engaged in psychotherapy training now for the last about 15 or 17 years, just so in order to introduce my work. I'm heading a postgraduate academy in Germany. It's maybe a specific German concept. It's a little bit like private universities. There are about 230 of them in Germany. We belong to the 5 largest ones. So people come over a period of 5 years and get a postgraduate training of a licensed psychotherapist. They must be a medical doctor, psychologist, or an educational scientist. And there's a large outpatient teaching clinic with more than 60 rooms where parallelly psychotherapy takes place, so it's a quite large thing. And so when I speak today about psychotherapy, that's what I mean. So the specific situation in Germany and some parts of Europe, I think maybe even Canada is so, that the insurance companies pay psychotherapy in Germany up to 100 sessions for adults, 180 sessions for youth, and 100% they pay. So when we speak about psychotherapy, this means you have really time to work with the patient, and money doesn't play a role, which makes things a little bit easier. On the other hand, we have a 6-month waiting list in Germany because of these things. So that's the training we are offering. This is, as I said, 4,200 hours, so really made in Germany, very strict concept. And at the end, this is the final state examination. You start here, you go through that. So it's like a 4 or 5 year of residency, but after that you can open your private practice. Anyhow, my plan today, I would like to say a few words about the origin and history of positive psychotherapy, summarize up the main characteristics, share with you the 3 basic pillars or principles, say a few words about the clinical applications and the worldwide network. In this I get, I guess, in less than 10 minutes, because I guess 2 minutes have already passed that. Yeah.
8 minutes and 12 seconds.
But you know, in our work we are used to that the patients put a lot of pressure on us, so really tell me in a few minutes what is my problem, so it's a normal situation like that. I guess the whole story starts with the vision. And maybe this is a good proverb for that if you want something you have never had, you have to do something you have never done before. So the vision started in the late 1960s by Hamid Peseschkian, my late father, who was an Iranian-born German board-certified psychiatrist and psychotherapist. And I guess he was inspired by 4 or 5 things. One was the spirit of the time, late 60s, early 70s, especially, I guess, from humanistic psychology. Then some personal encounters with Viktor Frankl, Moreno, Meng, and others. Then inspired by the humanistic teachings and virtues of the Baha'i faith. And especially looking for a method, how you can integrate different methods, especially also at that time, there was a lot of problems between psychoanalysts and behavior therapists, often not even speaking with each other. And the idea was how can you treat clients and patients from different cultures. And then in 1977, he came up with the term positive psychotherapy, at that time positive Psychotherapy, German. Then in 1987, this was also published in English. We have a few copies with us if you're interested. And then, actually interesting enough, in 1987 also he used the term positive psychology, also briefly then, and then there are many books and so on. What does it mean? The word positive in this context is used in the Latin, from the Latin origin positum or positivus, which means the actual, the real, the concrete. Nowadays you can look it up in Wikipedia, at that time it was not so easy. So actual and real are not only the conflicts of a client or a patient, but his potential, his capabilities, his ability to deal with this situation, his ability to become healthy, and so on. So the main characteristics are that it's an integrative psychotherapy method. We would say that it's a humanistic psychodynamic method. It is conflict-centered and short-term. And its semi-structured approach helps us to work with different clients, but also from different cultures. We use a lot of stories, anecdotes, wisdoms, humor. My father always used to say, if a patient does not laugh at least 3 times in a session, the whole session has been in vain. At least 3 times. And he was really living that. And we apply this in psychotherapy, counseling, education, prevention, management. So with a short picture, one could say that this humanistic psychodynamic approach really includes many elements from the other main directions then, which I will explain now in a moment. So the 3 basic principles or pillars are the principle of hope, the principle of balance, and the principle of consultation. It's good, one doesn't need to send a presentation, everybody makes the pictures, it's very easy. Yeah. The principle of hope is based on this positive conception of human nature. In German we have a specific philosophical word which is called Menschenbild, something like image of man, conception of human nature, which you could also say it's like resource-oriented, salutogenetic, positive, humanistic. So we often bring the example, human being is like a mind full of gems, so everybody is unique, has a great wealth in himself, and it's a question how to develop this potential. Based on this basis of a positive conception, then the therapeutic relationship changes. Whereas in the traditional concept, between therapist and patient are usually the illnesses, disorders, and so on. In the positive approach are the capabilities, capacities, today I think we would say the virtues, the potential of the patient. Out of that, then the concept of positive interpretations of different illnesses develop, and my colleague Maxim Goncharov in a few moments will go deeper to that. The second pillar is what we call the balance model of positive psychotherapy. We don't say work-life balance because work belongs to life, so therefore it's a life balance model then. And so we say that each human being has these 4 basic abilities, and I guess you will see some similarities, I think, to the PERMA concept of positive psychology. I think it's very similar. So that depending on the family, the time, the culture you are raised in, some areas are more developed than others. Our research has shown that in Western countries, usually, this body and health are very important, and the work and the job. In Eastern cultures, it's more the relationships and the questions about goals, meaning, spirituality. And in the third, and in countries like which are between East and West, is often achievement and relationships. It's okay?
You have 2 more minutes.
2 more minutes? It's okay. Somehow the time in the States pass faster than in Germany. Okay, I see that. Okay, and then we make with the patient some kind of assessment. So we go deep into that to see how much energy have they distributed in each of this area, and we say that you can be only healthy over the long run if you put 25% of your energy, not of your time, in each of these areas. Then, but that's something I hope Maxim will a little bit go then deeper to that. The third pillar is the principle of consultation, the 5 stages, how we get from a conflict to the solving of the goals, and the last thing is broadening of goals. What are you going to do if you don't have problems anymore? So that's one of the first questions we ask actually in the first sessions. Imagine we solve your problems, what are you going to do then? So the clinical application, we apply mainly this in mental health, in depressive, anxiety, adjustment, stress disorders, children in emotional disorders. A lot of emphasis is in the psychosomatic field, and especially also with death and grief therapy, and in different kind of settings. There are different empirical tools we use. We have like an inventory, different questionnaires, and especially a semi-structured first interview. Very good, yeah. Well, this is briefly about the organization. This World Association is very engaged in training programs all over the world, and there's a specific system, so how people are trained. I have here some materials you can take with you. And I would like to end with a saying of Victor Hugo, the French poet, who said that nothing is as strong as an idea whose time has come. You know this? And it's interesting that there have been 3 visionaries who developed or brought positive in this area of psychotherapy, psychology, and psychiatry. And I had the great privilege to meet all 3 of them. And so with this, I just would like to end my presentation. And so thank you very much for your attention, and I'm looking forward to the discussion. Thank you very much.